Hi, it's Dr. Eric Balcavage, and we're back for another edition of Thyroid Thursday. And today I want to talk about hypothyroidism and fertility. I had a person ask me if there was a link between the two, if their hypothyroid condition was impacting their ability to get pregnant, to stay pregnant. And without a doubt, thyroid physiology plays a role in just about every aspect of your ability to have a normal cycle, to produce a proper follicle, to get pregnant, and to maintain a pregnancy. So I want to talk about a couple aspects of the process, kind of outline those a little bit. And so we know through research that those people who have hypothyroidism, and we know that Hashimoto's is the most common cause of hypothyroidism, that hypothyroidism can cause somebody's cycles to be longer than they should be, greater than 35 days, or to be very scant. One interesting fact is that about 8 to 14% of reproductive age females show that they have thyroid antibodies. And there is some link, although there's not a lot of research on it, there is some association with increased thyroid antibodies, especially TPO, and infertility problems. So kind of keep that link together. There just isn't a lot of research and data on it, but there is associations, okay? Hypothyroidism, thyroid hormone levels can affect the development of the follicle. So if you can't develop a follicle, you can't get pregnant. Low thyroid function, hypothyroidism can cause compromises in ovarian function. We see even for the men who have hypothyroid issues or low cellular thyroid levels, can have decreased sperm count, reduced sperm motility, and we need those guys to swim for females to get pregnant. And it can actually change the morphology of the sperm, kind of damage the sperm. We can see in people who have hypothyroid conditions decreased fertilization. We see problems with endometrial reception and function. And one of the reasons why is when somebody's hypothyroid, thyroid hormone is really important for the production of progesterone to thicken the endothelium. And if you're hypothyroid, you're not going to produce as much progesterone to thicken that endothelium, or the endometrium, I'm sorry, and that's going to create problems with implantation. So low thyroid hormone, low progesterone, decreased production of a nice thick endometrial lining for implantation, okay? So implantation is not going to take place. We can see disturbed embryogenesis. So we can get pregnant, we can develop the embryo, but it doesn't develop well because of poor thyroid function. And we can have compromise of placental function as well. So all things, oocyte, endometrium, embryo, and placenta have all been shown to have thyroid hormone receptors, deiodinase enzymes, and thyroid hormone transporters. So every aspect of the ability to develop a follicle all the way through to getting pregnant and staying pregnant requires appropriate thyroid hormone function. And we know, and especially if you've watched a number of these videos, you know that you can have totally normal glandular function, normal levels of TSH, T4, T3 in the serum. But if the T4, T3 does not get transported into the cells, these types of cells get converted to T3, bind to the thyroid receptors, nothing happens, or there's reduced function. So it's really important that we do more than just look at a TSH and T4. Matter of fact, if you are trying to get pregnant, I highly recommend you reach out to a functional medicine doctor, have a comprehensive thyroid panel with antibodies performed, also have a comprehensive metabolic panel done. Really get an idea of what your state of health is prior to trying to conceive. Now, not everybody thinks about that prior to conceiving, but if you've conceived before, if you've gotten pregnant but not been able to maintain the pregnancy, then before you try another time, you really owe it to yourself to find a functional medicine doctor and get a good functional medicine workup. Find out if you have some level of cellular hypothyroidism, autoimmune issues going on, or just even a glandular problem that's not being looked at or not being seen because only TSH is being run. So that's it for today's Thyroid Thursday. That's a fast one. If you've had any problems with getting pregnant, maintaining a pregnancy, then you really need to take a look at what's going on with thyroid physiology, because there is a definite link between hypothyroidism and fertility. All right? Hope that helps. If you have any questions, put your questions below wherever you see this video, or you can always call my office, Chronic Condition Recovery Center. All right? Stay tuned for another Thyroid Thursday in the coming weeks. Okay? Take care.